I'm William Sproul. I'm 79 years old. I live with my wife, Pearl, on the family dairy farm outside Strabane. I'm semi-retired now, but I still rear beef cattle. And I do other things on the farm, such as drawing silage or slurry or sowing fertilizer.
I'm Tom Diamond. I'm a retired pancreatic surgeon. I worked in the NHS for approximately 30 years, and during that time I operated on a lot of patients with pancreatic cancer. Since I have retired, I'm still involved with pancreatic cancer in my role as president of NIPANC, trying to highlight the important aspects of early prevention and detection in pancreatic cancer and emphasizing how time really does matter in the early diagnosis and management of pancreatic cancer for an improved outcome.
I've survived pancreatic cancer for 10 years. I was first diagnosed in September 2013.
William's story would actually be quite rare, unfortunately, in pancreatic cancer. It is one of the more aggressive cancers we see, and the majority of patients don't survive beyond 5 years. So for William to survive beyond 10 years is an excellent outcome for him.
My urine, it was discoloured, it turned dark. It was that way 3 weeks before I went to the GP. And I had jaundice then when I went to the GP. I went from my first notice, the urine, I went 2 to 3 weeks after that to the GP.
William's initial symptoms are very typical of the common symptoms in pancreatic cancer. This is due to the development of jaundice, and associated with jaundice is the development of very dark coloured urine and very light coloured bowel movements. So if patients notice any significant change in the colour of their urine or their bowel movements, and particularly the early development of jaundice, they must seek medical attention urgently. As well as the very definite features of pancreatic cancer, such as jaundice, dark urine, and light-coloured bowel movements, patients may notice more subtle symptoms, such as significant lack of energy, weight loss, and in particular, relatively non-specific upper abdominal pain. This may be interpreted initially as pain due to excess acid in the stomach, but it's very important that if that doesn't resolve with the common antacid medication, the patient should return immediately to their GP.
I was diagnosed in end of September, beginning of October 2013, and I had the Whipple procedure on the 18th of November 2013.
It's very important that patients get treated urgently for pancreatic cancer. And when the presentation was, as in William's case, with the definitive features of pancreatic cancer, jaundice, dark urine, and light-coloured bowel movements, then a red flag referral can be made to the GP so that they're expedited through the investigative and management process through to an operation. That was a very good time frame. It got him to surgery within 6 or 7 weeks, and that was key to his good outcome. Physical fitness is a key issue in survival from any type of cancer, particularly when it involves such as a major operation at the initial phase of the cancer pathway. In the second phase of the cancer pathway, it often involves chemotherapy. So if a patient is physically fit, it means they're much more robust and able to tolerate the major surgery and the subsequent chemotherapy. However, that doesn't necessarily mean that patients who aren't very physically fit, as William was, still can't get a good outcome if they're diagnosed and treated early.
I and my wife, Pearl, knew nothing about pancreatic cancer at that time, but now that we know so much about it, I would advise the public if they had any change in their health at all to go to the GP right away.
The key message to the general public is that if they have symptoms which they're concerned about, they should seek medical attention urgently. For pancreatic cancer, the common symptoms are development of jaundice, which is associated with light-coloured bowel movements and dark-coloured urine. Pancreatic cancer can present in more subtle ways. The more subtle way is with non-specific upper abdominal pain, and it can sometimes present with pain in the upper back, roughly in the area between the tips of the shoulder blades. If patients have symptoms like that, which aren't responding to common therapies such as antacid treatment, they should go back to their GP. It's extremely important not to be enduring symptoms, and they must seek attention at an early stage if the symptoms keep recurring. Time matters in pancreatic cancer because it is one of the most aggressive cancers we treat. If we detect it at a stage when the cancer is confined to the pancreas rather than spread to the lymph nodes, we have a very good chance of getting a good outcome with surgery and chemotherapy.